Well, good morning. This is John Dombrowski at the Washington Pain Center. And we're here with a family. We just talked about getting an implant for sobriety. And and they were very courageous enough to share their story about, what was going on in their family and why they think they, wanted to go in this direction. And maybe they can educate moms, dads, brothers, sisters, loved ones out there that, might think of this as a possibility in terms of helping them in the future. So, Mom, we start with you. Tell me how we got here. How did we find each other?
My daughter Rachel's psychiatrist recommended Sublocade shots, and recommended you. We live in Baltimore, but we came here to meet you, and then you said that there's an implant that can be utilized. That why wouldn't you do that? Because it lasts much longer, and it's not in the hands of the patient anymore or the addict anymore. So my daughter was the first one to say yes, and I was grateful.
Right. And now you just had this procedure just 5 minutes ago?
Yeah.
Okay. Now, obviously, a lot of, patients are always nervous about how bad is this going to be. Now, I did not give you $20, did I?
No.
Okay. I didn't give you any money. So how was the experience here? What did you think?
I think it's good
Why do you think it's so good?
because even if I wanted to get high, I wouldn't be able to. I would just get sick, and I think that's the best part.
And what other reasons did you kind of think of the implant versus like the Sublocades or?
It lasts much longer.
Okay.
For a more extended period of time.
Okay. And anything else in your journey? Have you tried sobriety in the past, or?
Yeah,
And how many runs at that did you try?
a lot, and it didn't work
Okay, and that meant like rehab and junk like that. How
Yeah.
many times did rehab for you?
once.
Okay, and then the other times you kind of did on your own.
Yeah.
Fire. And with respect to people out there, one of the frustrating we were talking about is that no one knows about this. So how do you think we can get the message out there more effectively for families and children and the people that we care for in our family? How can we get it? How can we do a better job?
I think you need to advertise, like maybe a commercial or a billboard or something.
Okay, all right. And Mom, what do you think about that?
I think the physicians, like Rachel's psychiatrist in Baltimore, didn't know about it, and he's an addiction psychiatrist. So that's sort of like unbelievable. So the doctors have got to get literature in states, cities. I mean, Baltimore's the worst.
Right.
And some means that he didn't know about it.
And when you said, getting the message out there, it put a thing in my head. I mean, educating other physicians? And when you were told about this, you met with a fellow from California via telephone.
Yes.
Were you surprised that this was even out there?
Yeah, because I never heard of it before.
Right.
I wasn't looking for something like this because you don't know what you don't know.
Right.
So we kept, going to different places to get Rachel help. And the relapsing was continuing. So when we heard about this, it was a big jump for her, for sure.
Excellent.
Yeah.
Excellent.
And
Well-
it's not invasive. I mean, we've been here for not even a half an hour. And it's done.
Right. Wow, pretty good. Well, thank you very much for sharing your story. You're very courageous, and we wish you success in your new journey forward, which is always great. Start of a new year, new journeys. That's perfect. Thank you for sharing.
Thank you.
You're welcome.